Many procedures are done to correct urinary incontinence. In different ways, the bladder neck and urethra are suspended from and anchored to the pubic symphysis or the pubourethral ligaments with various devices such as sutures, screws, needles, tape, mesh, or others. The Marshall-Marchetti Krantz is a surgery that suspends the bladder neck and urethra to the cartilage of the pubic symphysis. For females, a TVT, a tension-free vaginal tape, uses mesh for suspension. The transvaginal sling is similar to the TVT, but the sling is anchored in the bone. For males, a male sling can be used using cadaveric dermis, fascia lata, or pericardium anchored with screws. Sacral neuromodulation helps normalize neural activity between the bladder and the brain, enabling patients to experience improved urinary function. Bladder augmentation is performed to increase the size of the bladder. And lastly, a prosthetic urethral sphincter is implanted. The patient is placed in a lithotomy position for percutaneous implantation of iodine-125 or palladium-0103 seeds. Ultrasound is used for the placement of the radioactive seeds. As a reminder, many factors are considered when determining the best approach for removal of the obstruction. If the prostate is cancerous, a radical retropubic or radical perineal prostatectomy can be performed. A TURP, a transurethral resection of the prostate, implantation of radium seeds, or a cryotherapy. If the large prostate is benign, BPH, or benign prostatic hypertrophy, it can be removed by a retropubic prostatectomy, suprapubic prostatectomy, perineal prostatectomy, or TURP with or without laser. Perineal prostatectomy is a removal of the prostate through the perineal approach. This is a nerve-sparing procedure to preserve the nerves and blood vessels that innervates the penis for erectile function. The precision for this procedure is high lithotomy. The suprapubic prostatectomy is similar to the retropubic approach. The difference is the bladder is entered for access to the prostate gland. Lymph node removal determines if the procedure is simple or radical. The retropubic prostatectomy can be simple or radical depending on the lymph nodes that are removed. Regardless of an abdominal incision is made and the bladder is not entered to remove the prostate gland. Laparoscopic and robot-assisted prostatectomies are minimally invasive and give the patient the advantage of decreased blood loss, shorter hospital stay, decreased hospital stay, etc. The disadvantages are the increase in cost because of the disposable supplies and the cost of the Da Vinci machine and extra training.